Ladies and gentlemen, my name is Всеволод Mahov. I am the medical director of the Inferum group of companies. It is a great honor for me to present to you our unique product, the physiotherapeutic device ABP 051. This medical device is intended for blood pressure correction. But is it possible to influence blood pressure through physiotherapy? The answer is yes. This is possible due to our patented technology. Now I will explain how it works. We all know that blood pressure depends on the balance of the autonomic nervous system. Consists of two divisions, sympathetic and parasympathetic. They should be in balance, then the blood pressure will be stable. If the sympathetic tone predominates, the pressure increases. If the parasympathetic tone predominates, the pressure decreases. Therefore, to lower blood pressure in a person with hypertension, it is necessary to stimulate the parasympathetic division of the autonomic nervous system. That's exactly what the ABP 051 does. How does ABP 051 do this? Here you see two electrodes. If you place them on the inner side of your left wrist, as I show now, in the area of the median nerve, and press this button next to the red palm icon, the ABP will begin to send neuron-like electrical impulses to the median nerve. Thus, we stimulate the tone of the parasympathetic nervous system, restore the balance of the autonomic nervous system, reduce the tone of small arteries, reduce peripheral vascular resistance, and thereby lower blood pressure. Arterial hypertension is a lifelong disease and cannot be completely cured. Therefore, ABP should be used for many years twice a day, morning and evening, even if your blood pressure is normal today. After 2 weeks of use, you can take a break for 2 weeks. But then be sure to start the 2-week course again in the morning and evening for 2 weeks. The ABP should only be used while sitting or lying down. We do not recommend standing or walking during the therapy session. Put the ABP on your left wrist, like I'm showing you now. Tighten the elastic band and press the button next to the red palm icon. The session will start and last a little over 5 minutes. After 5 minutes, the device will automatically turn off and you can take it off your hand. At what degrees of arterial hypertension can ABP be used? It can be used for all degrees, stages of hypertension and any cardiovascular risk. But there are several important features. In case of first-degree arterial hypertension and low cardiovascular risk, ABP can be used as monotherapy. People with grade 2 or 3 hypertension or people at increased cardiovascular risk, the ABP device should be used in combination with blood pressure medications prescribed by the doctor to increase their effectiveness and improve health condition. But as you remember, ABP has not one operating mode, but two. The second one is intended for people whose blood pressure is not elevated, but rather lowered. Arterial hypertension is not as dangerous as hypertension, but it causes inconvenience to a person. Tone decreases, fatigue and tiredness appear, performance decreases, and of course the patient wants to improve his health condition. How to do this? Place ABP 051 on your outer left wrist and press the button next to the blue palm icon. The session lasts just over 6 minutes. During the session, we stimulate not the parasympathetic, but on the contrary, the sympathetic nervous system in order to improve the health condition and well-being. Most people with hypertension feel significantly better if they use the ABP 051 device twice a day, morning and afternoon. So one more time, to lower blood pressure, put an ABP like this and press this button next to the red palm icon. To increase pressure, put it like this and press the button next to the blue palm icon. Technologies used in ABP 051 are patented. They have been clinically studied and widely used in medical practice for nearly a decade. And one more important note, the main cause of autonomic imbalance is stress. This is what increases the tone of the sympathetic nervous system. Try to avoid stress whenever possible, but if it's not possible, use ABP. I'm confident that you should use ABP today. Thank you for your attention and see you soon.